coming to the end of my training now. But for the last year, I've been doing a specialist leadership placement with the Psychological Professions Network in the North West. And as a big part of the project work I've been doing, I've been chairing a steering group, which is looking at experts by experience inclusion and representation, both within psychological professions, but also more widely in services. So all of our names you can see up on the screen today, but unfortunately we're not all here today to present. But Alison, Bev and Joe are here, and I'm very much looking forward to contributing to some of the learning that we'd like to share over the last year. They're going to introduce themselves a bit later. I'm going to do some of the more setting out the context and aims part before they come in. I guess just a couple of things. So the language that we're using is experts by experience. I'm probably going to use the word EBE throughout just for time work, but I guess I wanted to make everyone aware that other people might use different language to describe involvement. So patient and public involvement or service user consultants. But as a collective group, we use the term expert by experience. And we're very much looking at this sort of webinar as a learning experience for us as well. So we've been doing a lot of work looking at involvement in psychological professions, but we very much wanted to get information about kind of wider organisations that sort of surround that and work together. So we're hoping to learn a little bit from the people here today. So I'm going to give a little bit of housekeeping. So just in terms of today's session, it's being recorded. Katie obviously has introduced herself. She's here to support with any sort of problems getting into the meeting or being chucked out. So please do email Katie for any assistance with that. We also have Claire Bagley, who's going to support us with the chat and will feed back any questions. Now, originally, when we were thinking about the content for the webinar, we were hoping to take questions throughout the presentation, but I think just with regards to time and the fact that it's people's lunch breaks, it's probably not feasible. So we'll try and leave some time at the end for questions, but please do put them in the chat and Claire will collate them for us and feed them back. And I guess the first sort of question that we have for people is what examples do people have of including experts by experience in HE's activity? And if you can type sort of any examples in the chat, we'll come back to that about halfway through. But also, if there are any questions or any sort of hopes about the session, please also put those in. Hopefully we'll cover quite a lot today. But if not, we're seeing this as a start of a conversation. So it might be that we take those questions away and think about developing another webinar to address any of those queries. Yeah, so in terms of the webinar, we sort of want to set out the national context for experts by experience involvement. We actually developed a survey looking at EBE involvement in the training of psychological professions. So we did a survey that was disseminated across the North West. We're going to share a little bit of our learning from that. We're also going to talk a little bit about the different factors associated with involvement, and Bev, Joe and Alison and myself are going to share sort of examples of good practice that we've experienced. So because we weren't sure how many people could come today and whether breakout rooms were a good idea, we actually wanted to do something a little bit interactive. So if people are sat in front of laptops or mobile phones, if they could put menti.com onto their device and just answer a question for us about whether people have any hesitations or worries about including EBEs in the work that we do. So the code is on the screen right now, but I'm going to have to switch screens. So I don't know if Claire or Katie, you could put that code into the chat. And
yeah, I'll pop it in there now.
Thanks, Katie. I'm just going to switch my screen. And hopefully we'll start to see people type some things in. And I guess sort of now might be a good time to invite Bev, Joe and Alison in to think about whether they've had any sort of hesitations about being involved in sort of work.
Well, I certainly feel that when I first started, I was very new to this whole landscape. And I think what's been very interesting is how, and I'll explain this more fully later, about how my own self-confidence has built up over a period of time. But like anything new, when you're starting out in something, getting the understanding, sort of acronyms, understanding, sort of where various parts of the jigsaw fit together can be a little daunting. But I was always empowered by the notion that I was helped by people around me, both by experts, by other experts, by experience, had more knowledge of this than me, and by the various professionals that I was also working with. So it has been a very positive experience over the last 10 years.
Thanks, Joe. And we've got a few things up on the screen, so and not unusual hesitations as well, particularly I think around the logistics and the confidentiality element. That ensuring people feel safe, that's something we talk about a lot in our group, and difficult to, I think, to quantify, because actually people's differ in their level of safety and what they need to feel safe. We're going to talk a little bit about diverse representation in a bit, but I'm just going to switch my screen back again. And thanks for the people who added to the webinar there.
I think Alison might have a hand up.
Okay, Alison, did you want to?
Hi. It's just to echo what Joe had said, and I guess my hesitations were predominantly around confidence and having had a long period of lacking socialisation and being involved in the outside world due to my lived experience. I guess it was hesitations, feeling like even though I knew I had knowledge and experience, a sort of imposter syndrome sort of occasionally crept in because I lacked certain areas of knowledge. But the more EB experiences I've had of involvement, the more confident that has allowed me to become, to be able to share with you, like today at this webinar.
Thanks, Alison. And confidence is difficult, isn't it? It's not always a sort of a linear process. It's not something we feel all the time. And I think coming into systems, but also opening up systems to a different way of working, I think all of us would likely to feel hesitant about that. And I think being able to talk about some of those things and those sort of shared anxieties is really important when you're thinking about this type of work. So I said I wanted to set out a little bit of the concept. Sorry, go on, Bev.
I was going to say, when I first kind of made links, wanting to share my lived experience, I think that there was on occasion people weren't sure how best to use me, if you know what I mean. So it was a kind of a little bit of kind of needing clarification exactly, where we fit, and if rather than just being at a meeting so to tick a box, it's best so that we know exactly why we're there. Everybody knows why we're there. So
yeah, that's a really good point, and that's a process. It's not something that happens straight away. And I guess some of the learning we want to share today is what we've done to start thinking about that. And I guess in setting out the context, it's important, I guess, to think about where we're coming from as a group. So as I said before, people use different language, and individually people might refer to themselves in different ways. But as a collective group, our steering group talks about experts by experience. And we sort of broadly define that as people or family, friends and carers who've got lived experience of mental or physical health difficulties and sort of caring for somebody who does, and who've accessed sort of NHS or other services for support with those difficulties. We also know that there's a national requirement for the public to be involved in the design and delivery of healthcare services. More specifically to psychological professions, there are expectations for us around having expert by experience involvement across all of our training. So both in the development of curriculum, teaching, research, and dissemination of knowledge. So our registering and accrediting bodies, the Healthcare and Professions Council and British Psychological Society, set expectations for training courses and for other services around that. And we know that the research shows that there's benefits associated with involving people and working in partnership. So some of the research talks about it enhancing the learning and practice of healthcare professionals, but also the research does show that having service users involved in kind of co-production helps to deliver better outcomes for people who go on to use services. But I guess one of the things that we found a particular kind of difficulty, I guess, is that despite that sort of general agreement that it's necessary and beneficial, actually the application of EB involvement and the types of involvement differ across things like different services, different training programs, and regionally. So we decided to kind of get a better sense for our own sort of learning. So as members of the PPN, we are representing sort of 12 different psychological professions. And we actually disseminated a survey, as I said before, to look at how EBs are involved in those training courses. So we actually had quite a small response rate. So we had 18 responses, and as you can see, the majority were from clinical psychology, although we also got responses from psychotherapists, psychological wellbeing practitioners, and health psychology. But there was obviously missing data from kind of the newer wellbeing roles, other forms of psychotherapy, and forensic and counselling psychology. And I guess also important to say that actually the majority of the responses we got were from training courses, so representatives of a training course or working within the NHS. So there are lots of information we don't know about how involvement looks like in sort of grassroots community services, those sorts of things. And we asked questions. So we asked questions about types of involvement, and we also asked questions around kind of good practice, hopefully collating some examples of good practice, but also what the barriers were for this being something that was sort of structured. We found that actually generally there's greater service user involvement than there is involvement for people who are carers or kind of family members. And that whilst selection of trainees, involvement in research and teaching were quite common, actually there was less meaningful involvement in kind of more of the structural things around programme developments, planning, and quality assurance. The examples of good practice we found, so people talked about getting teaching awards for co-production, sort of jointly delivered teaching days, involvement in interviews and selection panels, and development of materials. I think it's important to say here that in terms of the involvement in interviews and selection panels, the people who responded said that this was in response to recruiting sort of trainees rather than staff. And as you can imagine, there was like quite a lot of barriers to expert by experience involvement. So I'm going to go through some now, but obviously a few of those things were around sort of identifying experts by experience and also the lack of diversity in expert by experience groups. So people felt that they weren't necessarily representative of the wider population that healthcare professionals serve. People also talked about the impact of remote working being both sort of a barrier to inclusion and a positive to inclusion. So helping people to access, technology kind of ways of being included and interacting, but also excluding groups of people who didn't have access to that. More generally, the barriers were seen as sort of structural. So people talked about there not being enough time to develop this, it not being something that was inclusive to their job role, so it not really being given sufficient priority, and lacking awareness of what EB involvement is, what it could be, sort of best practice. And then I guess thinking more about the fact that there's no funding to support the coordination and development is the responses that we received, and no sort of lead place, so nowhere to go to think about things around toolkits or I guess support for developing this way of working. And this comes up time and time again, so it's quite an important point, but this sort of rigidity in terms of our systems. So there was barriers to things like payment, barriers to change, which made the experience a lot more difficult for people. So generally what came out of our survey was that there's a need for guidelines around EB involvement. People would respond well to having sort of regional groups to coordinate and support it. And support from places, for example, lots of people talked about support in terms of funding and commissioning to sort of mandate involvement in that way. But there are obviously gaps in our knowledge. So we looked at education and research, and obviously all of us are involved in different ways in those things. But actually we know less about workforce development, planning and commissioning, hence why we decided as a group to kind of come and talk with HE today to think about EB involvement in your organisation. I'm going to introduce Jo. Well, they're going to introduce themselves actually, but I'm going to invite Jo, Alison and Bev to introduce themselves briefly and just say a little bit about how they're involved at the moment. So I don't know if Jo, you want to start.
Lovely. Thanks, Jodie, and hello, everybody. I'm Jo Keeney, an expert by experience contributor attached to the clinical psychology programme at the University of Manchester since 2017. I accessed various therapeutic approaches for anxiety and depression in the 80s and 90s with mixed results. And when I retired in 2012, settled mentally in a much better space, I wanted to feed back what worked for me and what didn't and why. Initially, I was on the selection panel for undergraduate mental health nursing at the University of Manchester, and it was through that engagement that I became involved with the clinical psychology programme. At Manchester, we sit on the interview panel for aspirant trainees, asking the question of what they see as the role of EBEs in their training. Trainees have a long project to complete during the 3 years, and we have a research consultancy role in this, particularly at the start as they scope and shape their project. Lecturers point out our interventions are significant and the feedback from the trainees is overwhelmingly positive. We act as observers and adjudicators in trainees' clinical role plays, and pre-COVID, we're involved in an introductory lecture on formulation. In the next academic year, in a blended learning landscape, we hope to co-produce in areas of particular relevance to individual members of the group. Since 2020, I've been part of the Psychological Professions Network North West steering group, which has allowed me to understand teaching practices throughout the region. In tandem with this, I'm part of the group of trainers in clinical psychology involvement group, which gives me a broader UK perspective. Throughout, my focus has been in the areas of research and education. Thank you.
Thanks, Jo. Alison, did you want to say a little bit about yourself and the different areas you're involved with?
Hi, welcome everyone. I'm Alison Bryant. I have been an EBE or public advisor for the last 4 years. My lived experience has given me knowledge of a range of mental health conditions which I live with, and a range of physical health conditions which I live alongside with, and all of those aspects of my knowledge come to play as I act as an EBE. And my initial involvement was with the Liverpool DCLIN programme. I was very nervous to start with as an EBE, but it's that passion for knowing how valuable the EBU voice is within training allowed me to develop that role. And more recent times, I've been part of the PPN North West EBE steering group, which has allowed me to experience a broader range of the psychological professions, and it's great to be here today.
Thank you, Alison. Bev, would you like to introduce yourself?
Hi, I'm Bev. I'm a carer and also a service user who also for 25 years worked in education, adult education, primarily looking at developing people's skills if they have learning disabilities or autism, and also personal development program as well. I'm a member of LUPIN, which is Lancaster University Public Involvement Network, And being part of that, we do a lot of linked work and through selections, research, teaching and learning, having members of Looping on different boards. So every board that clinical psychology has at Lancaster, they have people, experts by experience on all the boards with feedback to all the Looping members. And Looping have been going a lot longer than I've been there. So I think it's probably about 11 or 12 years that they've worked with people with lived experience. So it's really embedded into the programme. And just like Joe, the feedback is that the trainees and the staff see it as a real benefit to the learning and the work that people do going forward. I think that's about it.
That's all right. Thank you, Bev. We thought it was a good opportunity to say sort of how we're involved, and actually, as a group of people, we came together last year in October to develop the inclusion of EBEs as part of the PPN, which hadn't been done before, and it's been a work in progress for us in terms of kind of thinking about how we work together as a team, think about what the aims of our team are, and kind of who takes ownership of what, and how we sort of share power and responsibility in that respect. So I just want to at this point give a little bit of a shout out to Hilary, Keith, and also Yvonne, who can't be here today, but who have had like as much as a hand in all of this, and in the content of this, and in developing sort of our group. So I guess it's probably important to say how I'm involved. So I'm involved in the group with regards to chairing as a professional the steering group as part of my leadership placement. But I've also been involved in other ways. So I've been working in mental health services for the last 12, 13 years. So I've worked across different services, including sort of IAPT, community and inpatient. So I've done different forms of co-production over those years, and with different groups of people and for different needs. So I guess this is a group that's kind of looking at professions more generally, and also the systems, the different systems and the way they relate to each other. So in terms of the pillars of involvement, as we've said, we've sort of thought about it as sort of this related relationship, and we also tend to think about them, I think, as disparate things. So education being different from research and different from service design and delivery, but actually as a group we've been thinking about how they have a relationship to each other. So research, for example, informs service design and delivery, commissioning informs sort of education and workforce development, and where experts by experience can be involved across all of these different pillars. And this, I guess, is an important part of our group. So we try to work in as much as possible a co-produced fashion, but we wanted to talk a little bit about the difference between co-production versus consultation. So often they're used sort of interchangeably as if they mean the same thing, but for us as a group, that's not our understanding of it. So for us, co-production is about an equal partnership where we work alongside each other, and that's through the inception of an idea right the way through to dissemination. So as a group, we have shared aims, we have equivalent decision-making status, and we share in the development of ideas and resources. And as of today, we also share in the dissemination. And that's the way we work. And it can be, I guess, probably more time intensive than consultation, but with regards to the meaning of it, we feel like it's really important. And I'm gonna, I guess, come on now to think a little bit about why it's important and what we'd like to share sort of today. But I wondered if we could go back to Mentimeter, it's the same code, and just think about if there are barriers with regards to HEE in terms of sort of co-producing with experts by experience, and whether we could just have a see of what some of those barriers are. I'm going to stop sharing again and switch out. Thanks, Katie. I'm going to invite Alison, Joe and Bevan just now. I can't see you guys, so you might just need to shout out, but if there have been any barriers for you guys with regards to co-producing when you've been in involvement.
I think maybe not understanding, the people not understanding what co-production means. So maybe people asking, coming in late into the process to get input. So that's been an issue that I've come across.
I guess, sorry, Beth, did I talk over you then?
No, you're okay.
I think one of the things I was going to say is it's where existing systems have been in place for EPE involvement, it's actually starting to transform those existing systems that were set up with all good intent, but may have legacy issues which need to be adapted to actually really allow true co-production to take place. So it's, you know, it does happen, but that it may need a little bit of encouragement sometimes.
Thanks, Sally.
My reflection is barriers for experts by experience themselves. You know, sort of if you're in a recovery process yourself, sometimes talking about very personal things can trigger adverse reactions, and your own well-being is hugely important in all of this. And sometimes you may be working on a project but feel you need to step back from that project because of ongoing difficulties and complexities in your own, if you like, mental health journey. And I think that sometimes can make it, you know, slightly problematical. That, you know, sort of when you're in perhaps not the settled place you might want to be in or aspire to be in.
Yeah, absolutely, Joe. And I think that's really important and often gets lost, like that. And it's a very human aspect that we all have times in our lives where we might need to step in or step out of something, actually, and being allowed the space to do that, and with like the sort of understanding around that, I think is really important. I'm interested in some of the barriers. The one that's making me laugh is that opening a can of worms things, because I think that can often feel like the case for lots of people, and also around language. So language is something that's really important, and I guess just in terms of a personal reflection from me, speaking the same language I think can be important, but I think it's also something that you can learn. And I also think there's space to not speak the same language, and that brings something different in, and I think that's important as well. And it's something, again, as a group, we might not all speak the same language, but we see that as a strength. It was something we were only talking about this morning, how collectively it brings something extra that others might not have. But there's definitely, I guess, some anxiety about opening that door to that way of learning. I'm going to switch back. Thank you guys for putting stuff in there. So we want to get to the less sort of boring bits from me, I'm afraid, and sort of share some of our kind of learning and yeah, what we've been doing over the last sort of year. So I'm going to hand over, if this comes up, I'm going to hand over to Joe now. He's going to talk a little bit about the benefits of involvement. This is something that we want to champion. We want to help people have an awareness of what the benefits are, both in terms of our own personal benefits, but also what we've seen and what we've learned from others as well. So I'm going to hand over to Joe now.
Thanks, Jodie, and thanks again, everybody. So I've been engaged in PPI work since 2012, and in that 10 years, I feel I have developed personally and professionally. Before retirement, I didn't always feel I was listened to. I feel I am now, and my personal experience counts for something. Engagement has increased incrementally, like a droplet in a pool. First Manchester, then the North West, and then nationally. Being an expert by experience and being paid appropriately as one is self-affirming and self-empowering, building confidence, breaking down barriers between us and them, service users and clinicians. Confidence begets confidence. A virtuous circle of good vibe ripples is set in motion and expands. Intersectionality has meaning. I can be a service user and a carer simultaneously, and a strong sense of partnership with clinicians, of being on the journey together, takes shape. Much more confident than I was when I set out in 2012, I feel as an EBE I am being heard, and I am part of an urgent ongoing conversation during this transformational time when disruptive technologies and overwhelming demand are challenging the way we do things. The goal is simple: to help clinicians work wisely and well. Thank you.
Thanks, Jay. I like the wisely and well part of that. And I think something you said about intersectionality is really important, because whilst you can be a service user and a carer, which you've heard about today, you can also be a professional with lived experience of mental health difficulties, and you can be a service user and have professional qualifications that help you to add something to service development or other forms of involvement. And I think sometimes that can get lost. There's something about us already having a shared language, and about working to make services something that, if we had to enter ourselves, that they feel fit for purpose. And I think we only do that by listening. And it's nice to hear that there's something about confidence as well that's come out of the work. Definitely. Something that comes up a lot in our group. It sort of tends to keep coming back to this word, really, and that's about transformation. And Alison's now going to talk a little bit about that from our perspective as a group. Alison.
Hi everyone, I'm so happy to be part of this webinar today, as it allows me to share my perspective on the impact that EBEs have on care. Being an EBE is now part of my life and part of my identity, and it's been instrumental in my own personal journey of transformation. My health issues were long-standing, and at the intersection of hard-to-manage physical conditions and complex mental health conditions made it difficult to look outward and be mindful of what it is like for others, for the families, carers and health professionals who work together to give fractured individuals the best chance to have an optimum outcome. But I have been very fortunate to find meaning and empowerment through becoming an EBE and public advisor. This all came about after the intervention of my then clinical psychologist. She valued the part EBEs had played in her training and explained how this had shaped her to become a different practitioner to the one she had been at the start of her doctorate. Her suggestion was for me to utilise my lived experience as an EBE, which ultimately allowed my inward-looking self to begin to look outward, to explore how my lived experience and what my lived experience consisted of, and what knowledge I have that could be focused and harnessed to make a difference. The opportunity to improve outcomes and better care for other service users was really what really drove me. And through sharing those experiences and understanding on training courses, enabled me to find my voice, which had been silent for so long, and certainly would never have done any public speaking. I have collaborated in research, in co-production and as co-author, and sent countless emails and texts to bring awareness and change to services and systems. All of this has enriched in so many ways. For example, my involvement as a member of Lexi, which is the Liverpool Experts by Experience group who support the Doctorate in Clinical Psychology training course at the University of Liverpool, has offered me the opportunity to shape content, design and deliver teaching, to contribute to workshops, to act as a research advisor, and to be involved in the recruitment of staff and trainees. And my opinion, I'm very happy to say, holds equal weight and validity to those that I work alongside. My involvement and that of all Lexi members adds value to and enhances the experience and understanding of trainees during the 3 years of their training. Of more recent times, being a member of the steering group for PPN North West has given me the chance to broaden my knowledge of the psychological professions, and as part of this group to propose changes that will make a difference, sharing examples of best practice, highlighting barriers that need to be addressed and concerns to be allayed, all promote the benefits of EBE involvement. Working with ARC North West Coast as a public advisor on projects which tackle and transform systems and policies through research has given me another platform as an EBE to add value. Fellow ARC North West Coast and PPN North West member Keith Holt asked this question recently. Systems, who has the power to make change? And the answer is we do as EBEs. From our non-EBQ perspective via co-production, we have the voice and the vision to address inequalities and outcomes in healthcare. Recently, being involved in the commissioning process with Health Education England for accreditation has opened up a new door for me and for other EBEs to be at the table on an equal footing. This is in regard to what and how and to what extent EBEs are embedded in training programmes. Within the NHS, EBEs help inform best practice to create change for service users and communities who face health inequalities, and we encourage diverse groups and voices to be heard. This is essential if we're going to develop better healthcare outcomes and widen access to communities that traditionally have not been well represented. All of us can contribute to create real solutions as part of a movement of transformation, whether we are EBEs, EBQs, psychological professionals, training courses, HEE, government, NHS, or wider services and systems. We can strive together to shape and deliver a better future by listening to the expertise we all have and finding new ways to communicate and share that knowledge. I know I speak for the members of the PPN North West Steering Group when I say that though we have as individuals had different experiences and faced different challenges in our lives, we are united and committed to being advocates for change. There may be times in our work where we take the role of a critical friend, but this is only to ensure those better outcomes in healthcare when voices at the table like our own have insight and perspective that may be different or challenging, but always remain focused on the goal embraced by everyone here today to really affect change and enable healthcare to be transformed. PPN North West Steering Group member Hilary Tetlow encapsulated why I'm here today and why we are all here. EBE involvement is a win-win for us all, as it allows the development of better clinicians and better service user care. I hope when you leave the webinar today, those words will continue to resonate with you to establish and embed EBE involvement, collaboration and co-production as best practice for us to find solutions in healthcare and achieve transformation of services together. Thank you.
Thank you, Alison. And thank you also for adding in Hilary and Keith's comments there. I love the idea of a win-win. That might be a good strap line for our group. A few things you sort of spoke about were around sort of inequity and inequality, and sort of our last sort of presenting slide is really sort of touching upon that really. So we wanted to talk a little bit about what's happened over the last few years with regards to the pandemic and the changes that have had to be made. And some of the distress and some of the outcomes in terms of inequity, in terms of oppression, in terms of the conversations around those things. And often when we talk about that, it feels never ending, I think, and fairly heavy. But we wanted to also think about it as an opportunity. And I'm going to invite Bev in now to think a little bit about that.
Thanks, Jodie. Hi, everyone. So, yeah, if we look back at, reflect back at the impact of COVID and maybe through all the negatives, maybe see what positives we can see. And I think for the NHS, we can see that, first of all, you're really seen as an important part of the community. And also, in response to COVID, there was the NHS all of a sudden had to be really adaptable, and changes had to be made really quickly because of the impact of a pandemic. And also, I think with that, it was seen that it doesn't have to be done a certain way. Things don't have to be done a certain way just because that's how it's always been. So there was a lot of turmoil, and but from it there was a lot of looking at solutions, and very quickly coming to solutions, and flexibility was shown, and this enabled you to see still support and work with others even through a pandemic. And actually, in some cases, it worked out better for some people, and it added to professional toolkits as well. So there were some positives from that as well. So when professionals work with people with lived experience of the service they provide, feedback has really shown there's a deeper understanding for the professional, and actually for the person they work with, but also a wider perspective, and the professional can feel more confident, and for the person that they're working with, maybe better outcomes as well because of that process of working with EBEs. So the opportunity I think that we have going forward in this time of really transition, so it's just another, never settle, does it? So it's another time for transition. The NHS, this is a perfect time to come together to improve the outcomes and experiences for everyone involved, because we're actually on the same side, which is great. We want the best it can be. So the feedback to barriers to collaboration that we've looked at a little bit today shows that maybe systems can be a hurdle even, but now we know if we can work these things out, and solutions can be found, because people have had to work in extreme situations over the last couple of years, and solutions were found. And there's no greater opportunity to make things work better than right now. And I just got to scroll. And I'm going to just read the quote. I know you can see it, but I just love it. The strange thing is, this is spooky. It came up on, this quote came up on my Facebook page yesterday. So I don't know, that's a bit crazy, but there you go. Between stimulus and response, there is a space. And in that space is our power to choose our response. In our response lies our growth and freedom. So thank you.
Thanks. Well, one of the things, so Bev and I talked a little bit about this slides only yesterday actually, and one of the things that did keep coming up was around the transition. And we know as an organisation, HE is transitioning at the moment, merging with NHSCI, and whether this is a good opportunity for us to invite some sort of shared working and shared learning about how to embed EB involvement into your activity if it's not already, and whether we can work together to sort of share understanding and learning in that respect. And that's really, I guess, what our webinar has been about today, sort of a way to share our learning, but also to invite an opportunity to work together. We're sort of coming to the end now, and I'm aware it's still people's lunch breaks. We've probably got about 10 minutes left, but Claire, I don't know whether to invite you in now and see if there's sort of any questions or take home messages that we might want to sort of share or answer.
Thanks, Jodie. So there's been quite a few comments that have been put into the chat box, and just to summarise, there seem to be sort of 4 key themes, and I don't know whether you'd like to comment on those or whether the team have any perspective on it. So I'll tell you the 4 themes, and then you can kind of think about them in the round. So I think there was a resonance in the presentation where there was discussion about, or I can't remember if it was Joe or Alison describing that difference, that the almost artificial difference that there is between being a service user and having other parts of your life. And the comment was how frustrating it can be to be asked in a meeting if you're a service user or a practitioner, whereas actually maybe you can be both. So there's something about these artificial divides. that we tend to silo people in, and what maybe a question about what can we do about that to enable professionals to also be able to sort of share their experiences. There was a comment about, I think Alison's presentation particularly provoked questions about the role of HEE in involving experts by experience in different parts of the system, of their systems. So things like commissioning training programs, quality assurance, and also workforce development opportunities like new roles, new ways of working. How often is HEE thinking about involving EBEs at each stage? And maybe that could be an area for the sort of rapid transformation that can happen during times of change that that Bev was referencing. That there's often opportunity at times of change. There was also a comment about opportunities through the development of the new integrated care boards, and that being something that could possibly also be an avenue for building EBE involvement. Yeah, and then a general comment that I think has come up a few times about crises and change can offer opportunity. I think Bev made that really well, that COVID brought with it some incredible challenges, but also the system and individuals have responded with you know, real action and imagination to some of those challenges that have led forward change. So a few comments in there, and also some questions based on observations. I don't know if you have any.
No, that's really helpful, Claire. I think particularly thinking about how we responded in a crisis type thing. I think as a professional working in systems like that, it can often feel that there's lots of sort of structural barriers, or that we tend to go around in cycles, and that cycle sort of returns back to the same thing again over and over again. But actually, with regards to COVID, our systems were able to flex and adapt very, very quickly to respond to an immediate need. And I guess our standpoint is experts by experience involvement is an important need. So we might need to do some flexing there to invite that in. But I'm going to invite, I guess, others in to respond to some of those things. One of the things that stood out to me in what you've just said, Claire, and whoever talked about it, is around these sort of labels that divide us, sort of thing. And it's something we talk about in our group. What else is people? What other qualities are people bringing other than just lived experience or other than professional qualifications? Because I'm more than my professional qualification. And I'm sure, like, the members of our group would say they're more than their lived experience or caring experience. And really, like, you know, people, I know that, like, someone in our group, for example, is a governor of an NHS health trust, and bringing those skills into the group is really important, and inviting that is really important. But I don't know if before we sort of end, whether Bev, Joe and Alison have sort of any take homes from this, or any response to what Claire's said. And I can't see you guys, so I'm afraid you're going to just have to shout out. So.
Maybe I can help with that. Who wants to go first?
I think that having a platform so that we can have that conversation, like Jodie said in the past, and the group said as well, this is just the start of a conversation, and moving forward, we're here to support people if we have the will that they want to take this forward and be proactive. I think we've got the will to support people to do that. So you don't need to know all the answers, and you probably have lots of questions first of all. But we want to share good practice, and we want to support you to not feel like you can open a can of worms.
Thanks, Bev. Alison and Joe, before we finished for today. Are there any sort of final comments from you, from Claire's sort of themes?
I guess that from my perspective, it's very much what Bev has just been saying, that really that you know, we need to really, you know, use our voices to really, you know, kind of affect change for the better, and whether that's within systems, organisations, you know, at whatever level, you know, an EBE can be involved. It's important to, you know, as I said, you know, earlier, to for us all to listen to each other, but it's finding those ways to meaningfully use EBE voices within those systems to really transform. And that's really what all of us want to do. We just need to be able to access those routes into that, into those organisations' services, to really make a difference.
Thanks, Ali.
Yeah, I just sort of think that COVID has been an opportunity. Lots of people are reassessing their lives, you know, sort of what are the important things for me? You know, sort of loneliness has been a real key issue for lots of people, and how do I, you know, sort of, how do I come to terms with that? And I think the challenge going forward is actually, yes, there is huge demand for services out there, and it's a matter of how then nimbly can we give, you know, offer the right service to the person presenting, you know, whatever difficulties he or she has. And I think that is the challenge. People want to engage in, if you like, talking therapies, and it's a matter of how can I quickly talk to somebody, you know?
Yeah, thanks, Joe. I think that obviously we talk about that a lot as well, like right service at the right time, and that can feel difficult. And I think one of the key things around that is around communication and listening and thinking about what's needed and what could support sort of the wider population. I'm gonna just invite Claire in a minute, just because I'm gonna put you on the spot, Claire. I apologise, but I'm sort of interested in some of the things that sort of came up in terms of HEE and how people can be involved, and how easy it is to think about EB involvement when you're working in a system where you kind of have to get things done. And I guess obviously your experience is also being part of our steering group as well. And I just wondered how you've taken that experience back into HEE and the PPN North West with you. And I apologise if that's put you on the spot, but
no. And as I've been listening to the presentation, it's really got me thinking about how much I've learned as part of the process of being part of the steering group. And I think it's really got me thinking about, I think, the 5 pillars and the way that you've really been able to draw attention to the whole system is really important. So traditionally, I think training programs in terms of their delivery, you know, on the ground with students, they tend to more naturally have a longer track record in involving people with lived experience within areas that HEE work is involved, such as commissioning of education programs, developing new roles, new workforce roles, and new ways of working. I haven't seen a lot of evidence of us routinely thinking about involvement of experts by experience, and it's really got me thinking about, should we be thinking about that from within HEE and thinking about experts by experience being embedded in all levels?
yeah.
So I've really taken a lot from that. I think there's work to be done, but I really hope that the steering group and this webinar is the start of a conversation that I can take back to colleagues,
Yeah.
to start getting them reflecting on what their role is in embedding experts by experience through the whole system.
Yeah, thank you, Claire. Sorry to put you on the spot there as well, but that, I guess it is helpful for us, and as Joe, Alison and Bev have said, it, I guess there are barriers that we know about. We know that it differs across different systems, but actually what's first required is the will for change. And I guess as a group, we really do have that will, and we really are inviting conversation or support for people who are starting to think about this, and how best we can kind of support with our learning. And that's not to say we're ever going to have all the answers. That's not the case at all. But I guess it's about the relationships and that being reciprocal in a way. So we're going to end there, but we'd like to sort of thank people for coming. And if you're watching on the recording a bit later as well, thank you very much for watching. We'd really like to hear from you as a group. So you're welcome to email me. My email will be on the slides. They'll be sent round for sort of any questions or any information. But actually, we've got a web page. So the link again is on the slides. So when Katie sends them round later, people will be able to access it. And our webpage gives you some understanding of the project we've been working on over the last year, our sort of shared aims, but also a timeline of what's to come. And as a group, we do time allowing a monthly blog just to explain where we're up to, and members of the steering group also kind of feed into the blog as well. So yeah, please either check out our webpage or get in touch with us, and we hope this is part of a continuing conversation, and we'd love to sort of come back. So if there are any questions or any sort of queries or any thoughts around developing another webinar, we'd really like to hear about it and be happy to sort of continue to share our learning. So I'm going to leave last comments maybe to Bev, Joe and Alison, and then we will end the webinar there.
I look forward to moving forward with you and having more people with lived experience working together collaboratively with people who are working towards supporting other people.
I would just like to say thank you very much, Jodie, and to Claire, and for all of the team who've supported this webinar today. It's really given me the confidence to be able to come forward and speak, so thank you very much.
Thanks, Sally.
Yeah, and finally, thank you from me on behalf of all of us, and us EBEs will always be your critical friend, and it's all about working wisely and well. Thank you.
Thanks, Joe. I think that's yeah, a nice way to end. So thanks, guys.